do? What you gonna do when they come for you? Bad boys, bad.
Apply soap. Lather your hands by rubbing them together with the soap. Lather the back of your hands, between your fingers, and under your nails. Scrub your hands for at least 20 seconds. Need a timer? Hum the happy birthday song from beginning to end twice. Rinse your hands well under clean water and dry your hands using a clean towel or air dry them. Once you're finished, turn off the water with a paper towel. You're done.
Bad boys, what you gonna do? What you gonna do when they come for you? Bad boys, bad.
Hey, stop right there, sir. This is a contact precaution room. You don't have the right PPE on. You've been served. You're gonna have to go to disease violation school. Got that? See you in court. Hi, I'm James. I'm going to show you how to enter a patient's room who has Shigella, which is contact precaution. So first, I go to the patient's door, I look on the sign, and I see that it's contact precautions. I first stop and I look at the requirements that I need to enter the patient's room. So it says I need gloves and a gown. So I'm going to check my inventory, which is usually next to the door on the room. And I check that I have a gown and gloves here. I'm gonna first wash my hands. Here I have hand sanitizer, which is an acceptable substitute if there's not a hand washing station near. So I let this dry up. I'm gonna put on my gown first. Now tie at the top first. Make sure that we close the back. We want to close off all ways of getting an infection. So I'll just tie myself up here. We'll tie around the waist, making sure that I'm closed in the back. If you have somebody or a tech with you to help you tie, because it's really not that easy to tie, that will be helpful. Okay. Now I'll put my gloves on. Just overlap it over the gown. Now check the board again, make sure that I'm good to go. Looks like I'm good to go. I'll go in the patient's room. Hi, I'm Officer Choice, and you guys have been served. Today, I'm going to teach you guys about the proper PPE protocol so you won't get exposed to any viruses or diseases like you did today. So in a moment, we're going to start a video presentation with slides, and we're going to run through this, and you guys are going to know how not to get this disease. So for this Shigella disease, Shigella is a diarrheal disease caused by a group of bacteria called Shigella. Shigella is compared in contrast to Salmonella, but they differentiate in many ways, such as they are different groups of gram-negative bacteria. Shigella is caught from person to person, while Salmonella is contracted by raw food. Symptoms of Shigella is diarrhea. You might have abdominal pain. And how this disease is treated is by combating dehydration for the most cases of Shigellas. Bacteria is spread through a contaminated food and water or contact with contaminated feces. These are the modes of transmission. Technologists can get this disease from being in contact with a person who has Shigella. The most populations who are likely to get Shigella are toddlers and preschoolers. And medication used to treat this disease is antibiotics to eliminate the bacteria from your digestive tract. So with these few questions that we got answered, you guys should never be exposed to Shigella. And I hopefully will not have to see you in this class again. Thank you. So I have a patient who has an affected arm, an injured right arm, and I need to put this gown on him for a procedure. The patient has Shigella, so I'm dressed in my PPE that's appropriate for the disease. So first, what I want to do to get this gown on the patient, I want to start with the affected arm. So first, I will be gentle and try to slide this under the patient's from the hand on up. Just be careful with the arm. Just raise it up. Then I go to the unaffected side, and he's able to move that and easily put it in. So here, have him lift up, and I would tie him in the back. My patient will be ready for his x-ray. And to take it off, I would start from the unaffected side, would untie, then roll this away from the patient. Be gentle. And that's how I would put on a gown for a patient who has Shigella.
Hi, my name is Niwe. I'm currently affected with lice, and I have the proper PPE to protect you and me and to prevent further spread. Today I'll teach you how to protect the lice. There are three types of lice that affect human body: head, body, and pubic lice. Compare and contrast Lice and scabies. Both are contact diseases caused by organisms. Symptoms: incredibly itching, scratching. Most population get this disease, particularly school-aged children, the age between 3 to 12 years old. How is the disease treated? The first step you do, wash the clothes, bed lines, both towels with hot water, which is over 130 degrees Fahrenheit. Vacuum furniture to help stop spreading your home. And including some prescription medicines, lice treatments like benzyl alcohol and ivermectin. And thank you. Hi, my name is Niwei. Today I'm going to show you how to transfer the patient who has a lice from gurney to the bed. The first thing you do, just take these things down, and then I'll ask the James push it forward a little bit, and then make sure all is locked. Yes. And then we will ask the patient to cross his arm and then bend his left leg and then turn him over to James. Yes. And we'll put this on this patient. Thank you. Okay, so we're doing this. We're gonna count to 3 and then we'll move the patients. 1, 2, 3. Yeah. After you do this, we're gonna move back the gurney. Please. And exactly, we're gonna ask the patient one more time to cross his arm and then bend his leg and towards two James, and then take the board. That's how you try. That's how you transfer from gurney to the bed the patient who has lice. Thank you.
Hi, my name is Daniel, and I'm gonna give a demonstration on airborne contact isolation. So first, we're gonna wash our hands. We're gonna use alcohol-based, and next we're just gonna put on our gown. So for the gown, we're gonna just put it on like so, and then tie the top. It's basically just like tying your shoes. Just make sure it's nice and tight. Next, we're gonna do the waist one. Make sure it's covered, everything's covered. Okay, next, we're gonna put on gloves. And make sure to cover the glove over the sleeve of the gown. And lastly, we're going to use the N95. This is very important for airborne because it keeps the particles out. So we're going to open up the mask and put both straps
over my head. Cover my mouth. Make sure one strap is above and one below the ear. Cover the whole mouth and nose. And mold it to your nose and make sure your chin's covered. So this is how airborne gowning is. And you want to make sure to check the sign outside the door, which says airborne, and you need a gown and an N95 mask and gloves. So we're good. I'm a previous offender for violating PPE protocol. I am doing community service to help you protect yourself from varicella zoster virus, which is aka chickenpox. Chickenpox is a highly contagious disease caused by the varicella zoster virus. It causes an itchy, blister-like rash. The classic symptom of chickenpox is a rash that turns into itchy, fluid-filled blisters and eventually turns into scabs. Other typical symptoms that may begin to appear 1 to 2 days before rash include fever, tiredness, loss of appetite, headache. A comparable disease is herpes zoster, also known as shingles. It is caused by the reactivation of varicella zoster virus, the same virus that causes chickenpox. The virus remains latent in the dorsal root ganglia, and you could possibly get it later on in life. Varicella is highly contagious and spreads from person to person through respiratory droplets, from coughs or sneezes, by direct contact, and when the virus from skin lesions become airborne. 2 doses of the chickenpox vaccine is more than 90% effective at preventing chickenpox. When you get vaccinated, you protect yourself and others in your family and community. Healthcare providers should follow standard precautions plus airborne precautions, negative airflow rooms, and contact precautions. If negative airflow rooms are not available, patients with varicella should be isolated in closed rooms with no contact with people without evidence of immunity. Patients with varicella should be cared for by staff with evidence of immunity. Groups at high risk for severe complications are neonates, infants, pregnant women, adults with immunocompromised persons. Chickenpox is normally a mild disease, but it can be serious and can lead to complications including bacterial infections of the skin, soft tissues, bones, joints, and bloodstream, dehydration, pneumonia, inflammation of the brain, and toxic shock syndrome. In addition to vaccination, you can help prevent the spread of varicella by room ventilation, rooms kept clean and wiped down with germicidal wipes, provide masks for patients, and hand hygiene and PPE. And that's the disease varicella zoster virus. Okay, so we just entered an airborne precaution room, and we're gonna need to lift the patient up in bed. So the first thing we're gonna do is a log roll. So anyway, I'm gonna ask you to put your hand on your shoulder and lift this leg up endlessly, and then we're gonna roll it towards James' side. And then I'm gonna lower the handrail and put a sheet underneath him. Like so. Okay, and then we're gonna roll knee way back. You can relax. And then you can lower your handrail. And then I'm gonna raise my rail up. And you can bend this hand that way and lift this leg up. And then I'm gonna roll you towards my side. And then you can put your rail up. Or you can roll back. All right. Then I'm gonna undo the rail, and then we're gonna. Okay, now we're ready for the transfer. So anyway, I'm gonna ask you to put your arms across, both hands across, and then bend your knees, and then you're gonna help us push up. All right. So we're gonna, palms are up, and you're gonna grab the draw sheet as close to Niwe, and on the count of 3, I'm gonna take a step to the left, and James is gonna take a step to the right, and then Niwe is gonna help push us. On the count of 3, 1, 2, 3. And that's the standard method for lifting a patient up in bed.